Hi there, I'm Diane Mulligan with Lung Cancer Foundation of America. I'm here with Dr. Christine Lovely.
Hi, Diane. Please call me Christine.
Thanks so much, Christine. We are here today to talk a little about the fact that you won one of our grants. So I'm really interested in what motivated you to even start researching lung cancer.
Sure. So first, I want to just start and say it's just such an honor to have been awarded this grant from Lung Cancer Foundation of America, and thanks to everyone who really contributed to this award. So this is my award, and my area of study for this particular grant is on a type of lung cancer called small cell lung cancer. Small cell lung cancer is not the most common type of lung cancer, but it is a type of cancer where, if you can imagine, we have not had a change in therapy for this type of cancer in 30 years.
Wow, I didn't know that.
So all the amazing advances we've had in cancer medicine that you hear about on the news on a daily basis now really have not translated into the care of patients with small cell lung cancer. So much so that in 2014, the National Cancer Institute called this a recalcitrant tumor, meaning that this is an area of very high priority for focus and study. In my particular realm where I practice in the southern part of the United States, we see a lot of small cell lung cancer, and I felt that the coupling of the Lung Cancer Foundation of America with this intense area of need was really a great match for the grant.
It sounds like it was a really great match. So tell me, what does the $200,000 grant mean to you? Is it enough? Do we need more? Where are we with that?
Yeah, so I think every amount of money that goes towards studying this disease is incredibly helpful.
Absolutely.
So $200,000 will help me to advance projects about small cell lung cancer, which I'm sure we'll talk about in more detail. But I think also what people don't realize in terms of research funding is that the research funding that we use in the forms of these grants not only helps to advance the science, but also really helps to train the next generation of cancer doctors and cancer investigators who are working in the lab trying to figure out how do we make treatment options better for these patients. So the money is used not only for the project to try to advance the science, but also really very much so for training as well.
And it's so important. We just need more dollars for research because it's one of the least funded cancers of all actually diseases of all the cancers that are out there. It's the most deadly, and yet it's the least funded when you come to lung cancer.
Absolutely. So if you look at the statistics, lung cancer is the number one cause of cancer-related deaths in the United States for both men and women. But lung cancer receives some of the least amount of funding of all types of cancers. And it's interesting that there's such a discord that we really need to take on this problem as a community and say, we're going to work together to figure out better ways to advance lung cancer science, to make better clinical trials, to really make the research studies come to fruition so that we see better outcomes for our patients.
Which is what we're all about. So tell me a little bit about one of the projects. You're working on liquid biopsy, is that right?
Correct. So this particular project on small cell lung cancer involves liquid biopsies, which is a new and exciting technique that has really come into the forefront of the way we practice medicine. So liquid biopsies, in contrast, if we take a step back and think about how do we study tumors in the first place? Well, typically what happens is patients will go in and they will have a biopsy of their tumor. For a lung cancer, that biopsy can actually be invasive because you have to go, and a needle often goes through your chest to biopsy the tumor in the lung. That's not an easy procedure.
Right.
It's challenging for patients. It can be challenging for doctors as well. So what we wanted to do was to use liquid biopsies, meaning these are actually ways to look at the tumor just by a normal blood draw. So we all go to our own doctors, whether it's a cancer doctor or just your family practice doctor, and you get your blood drawn out.
Right.
What we're doing is using just the normal components of having your blood drawn to be able to study this small cell lung cancer.
Makes it so much easier in that situation, I would think, for patients to really not have to have that invasion into their body if they can utilize this liquid biopsy.
I hope so. I think, in my opinion, we still need the tumor biopsies because that's going to provide us with the important initial information. Is it small cell lung cancer? Is it non-small cell lung cancer? My hope for liquid biopsies is that they can be used to monitor the disease over time, to be able to say, we know that this is small cell lung cancer. We're treating it with this kind of therapy. Is the patient responding well or not? And oftentimes what we showed and what we have already figured out in our preliminary studies is that when we look at the blood and we look at the mutations that are in the blood that are characteristic of the small cell lung cancer, we can find changes in those mutations as patients receive therapy. So best case scenario is patient receives a chemotherapy, they respond nicely, and the mutations go away. Sometimes we can use the blood liquid biopsies to actually see the recurrence of these mutations, and that may tell us, you know what, we really need to change our therapy now. We need to do more therapy, better therapy, different therapy. And I hope that liquid biopsies can really be used to monitor this disease in a better, more precise way.
So it's almost predictive in the way that you're using it, because you're looking at what could happen next. Is that correct?
We're looking at what can happen next, and we're trying to be as aggressive and as quick as possible in figuring out when is the tumor coming back. And what we've already been able to show in small cell lung cancer, but in other tumor types as well, is that you find the emergence of these mutations in the blood before you actually see the tumor start growing
Really?
on a CT scan. And so I think that this will be a way to have faster, more agile ways to treat patients, to be able to, you know, if a drug stops working, we want to switch right away instead of waiting and waiting until the tumor grows more.
And how, when you work with your patients, how does that really impact the patients? Getting that additional information, what does that mean for a lung cancer patient?
Sure. So I think right now in small cell lung cancer, these liquid biopsies are not part of the standard of care.
Right.
I hope that through my studies that are funded by the LCFA, that we can make liquid biopsies become more and more into our realm of normal practice. So whether you're at my institution getting treatment or whether you're in your community getting treatment, that liquid biopsy will be part of your care if you have small cell lung cancer. We're not there yet. And so my hope is that by studying this further and by understanding how we can use these liquid biopsies more, that this will become more integrated into normal practice in the care of patients with small cell lung cancer. Now, there are other tumor types, other types of lung cancer where liquid biopsies are routinely used. And that can be incredibly meaningful to a patient because it gives them a non-invasive way to understand what's going on in their tumor.
All this breakthrough research is so exciting, and it's one of the reasons that Lung Cancer Foundation of America is constantly focused on research, because we really want to make, not only do we want to cure, but as we're doing the treatments, we want it easier for the patients as well. And having people like you research it, we're just so lucky to have you. So thank you so much.
Thank you so much.